Well, we are in a marvelous time for scientific and biomedical discovery. All of us who are in that field, have been in the field, read about that field, know what an enormous privilege we have to live now when our tools are so wonderfully powerful. We heard a little bit about some of those advances, and we heard some of us who were here in this room earlier, very inspirational speeches by two Nobel Prize winners about their own individual careers. And both of them made an impassioned plea for continued fundamental scientific support in their research areas. And it was very clear as they unrolled their personal stories, which were really quite moving and unexpected, even for them, how important it was to have this wonderful National Institutes of Sciences Health. A little later on, we heard Irv Weissman talk about the problems of being a senior researcher or a junior researcher today in obtaining scientific funding from the National Institutes of Health, despite the $40 billion. How do we look at these problems? Well, as I said to begin with, the first thing we look at is the marvelous opportunities. And to anyone who travels the world today, you realize that science has always been global, but never more global than it is today. If you go to China, you see the best of scientists that have been trained in America, trained at the Pasteur Institute, trained in Sweden, setting up marvelous scientific laboratories. You go not to the Indian universities, but you go to their private sector companies, and you see senior scientists who have returned to India to create marvelous discovery laboratories, to turn India into a source of not generics, but new drugs of the future. It's happening enormously quickly. You see the entire world becoming engaged. You see many wonderful discoveries coming from Korea, from Indonesia, from Brazil, Argentina, around the world. That is a very positive picture. Can we use more money? Yes. Should we argue for more money? Yes. Should we carefully consider how that money is used? In some cases, this marvelous expansion of our ability to understand disease in terms of genes is made possible by mega grants, grants that we could not have imagined. In my own field in genomics, there's single laboratories getting $60 to $100 million. That is a lot of money. Is that money being used properly? There's a lot of room for debate, and I think that's where scientific community needs to be continually engaged, not in just how much money there is, but is it being spent appropriately, and how is that money apportioned? We also are very important, and I think all universities now have global outreach arms, and if they don't now, they are shortly. I've recently, just this week, traveled to two major American universities talking about collaborations with Indian clinical and industrial and other types of laboratories, and there's a tremendous drive. Where is that drive from? Not necessarily from the top. It's from our students. Our students want to be internationally engaged. That is the good side. I see a much darker picture than that wonderful optimism. I see this tremendous scientific and medical opportunity that we have created and is expanding at a very rapid rate in great peril of reaching patients for two fundamental reasons. The way we organize a translation of new knowledge to patient and approved drugs is fundamentally broken. I've been working in the pharmaceutical biotechnology industry for more than 25 years, both as a professor and as a chief executive, and somebody doing deals all over the world with these companies. That mechanism is sadly broken. We're spending more money, 10 times than we ever did before, and we're getting fewer results. I believe it's because companies have gotten larger and larger and larger, and in order to survive, need billion-dollar drugs, and anything that's a billion-dollar drug driven by the marketer is crushed, and you cannot do translational research in that atmosphere. We've got to fundamentally restructure. I have some ideas I'm happy to share, but anybody with a good idea who can help speed that process is welcome, because all of the knowledge we are creating will go for naught if we don't solve that problem effectively. So it's not only a matter of how much we spend, it's how that gets translated. And we in the public sector don't control that. It's how the private sector is organized to translate that knowledge into effective products that's in deep, deep peril. And anybody who's in the industry knows that instinctively. The second point I would say is that there is another major block to getting the benefits of even existing technologies out there. And that is how we organize healthcare delivery. We do spend 15% of our GDP. We do spend $2 trillion in healthcare services. Yet we are not number one in the world in healthcare outcomes. We're number 26 or number 27, and probably sinking. That whole machine of how we deliver healthcare is also broken. It's not just broken in the United States. I would argue it's being stressed globally, and it will be stressed further as this tidal wave of aging hits our healthcare services. We must find better ways to deliver high-quality healthcare and provide equal access for the poor as well as the rich. I brought with me to this conference some remarkable people who are working in a very difficult environment, Central India. They have created a healthcare system there, privately, doctor-organized, that is about 10 times as efficient in delivering high-quality health outcomes for complicated diseases, including cardiac surgery, than we do. Just a couple of numbers. Their total cost, using our machinery that they have to buy at our prices for open heart surgery, is about $1,500. And they're going to drop that by a couple of $100 by producing some of their own devices. There are much better ways to organize healthcare services than we do today. If we don't solve these two problems, translation of new knowledge into new products, a process which I would argue is demonstrably broken, or solve the problem, not how to pay for healthcare, but what it is we are paying for, because we are paying 10 times more than we need to pay through deep inefficiencies in how we structure our healthcare services. All of this new knowledge will not be put to use in any effective terms. So the issues that we face are truly enormous. They're not just how to fund research. They're how to integrate that into society to make sure we and every human on this planet has access to high quality, effective medical care.
Thank you very much. Ellis, you have the answer.
Well, I guess I have the anecdotes. I don't have the answer necessarily, but Bill set a good high standard for a little truth-telling. Sometimes we're too often in rooms with mixed audiences like this one, where we tend to focus on how wonderful the U.S. taxpayer is for pouring money into and approving pouring money into U.S. science. And we don't talk about some of the challenges that we have. But then we all do know that and I'm sure everybody in the room, whether you're a scientist or not, has read about the difficulties that our pharmaceutical companies are having. That system is really stressed unbelievably. It takes somewhere around $1 billion to produce a drug, and it takes much too long. And we all know, and we're just in another session where we could be hit by a pandemic where we don't even have a capacity for creating a drug rapidly enough for some kinds of pandemics. So we're living in a moment of really a cognizance of an enormous challenge in a lot of different areas. What I thought I'd do is go back to my roots as a science journalist and just report a little bit in some of these areas and hit some anecdotes for you that might be something that would drive the conversation when you all start asking questions. And in fact, in this room, there's so many experts that we never know who's going to answer the questions. But my notion is to just hit on 4 different areas to sort of set the table from my point of view. One is, in the area of pharmaceutical and drug development, we don't have time, we have to run a whole nother session, but basically there are a lot of radical ideas about how to change the process that is going on. You might have read that Novartis just signed a deal for $60 million with MIT. And what was the notion of that? It was somehow MIT and its engineers were going to figure out how to re-engineer their process in 2 words. And to me, this is a little bit old-fashioned way of a one-off